Hello, Nikhil. Welcome.
Thank
Namaskaram.
you, thank you, sir.
Great having you here in this interview. Really, a superb feeling to be coming as number one. Any field, anywhere, you come number one, and you have come number one in one of the most coveted seats in surgical oncology and in the number one institute across India, that is AIIMS. Everyone knows about AIIMS. When you say medicine, it is synonymous with AIIMS, and you have gotten the first rank there. So how does it feel?
I feel good, sir. I feel elated. Initially, when I got the result, I was not able to believe. Then I got some 10 friends to check whether it is actually true or is it like just I'm dreaming or something. So I took almost 2 days to actually come to the reality. So yeah, it's a good feeling, sir.
Great, Nikhil. Great, Nikhil. So, congrats once more. And
Thank you, sir.
tell us a little about yourself. Where did you do your undergraduation, post graduation? Where are you from?
I'm basically from Belur, sir. It's in Karnataka. Uh, I did my undergraduation from Asan Institute of Medical Sciences. That's also in Karnataka, sir. And I pursued my MS from Jitmar Pondicherry. I recently completed my MS in the month of September, sir. And I wrote my NI in this October 26th.
Wow, September to October, just a month, and you've gotten in and you got the number one rank. Really superb, Nikhil. That's
Uh,
perfect. Nothing can beat that feeling. It's really stupendous what you have done, and
thank you, sir.
great. Again, Belur is known for all its statues. No, Belur, Halebed, all those areas are very famous for all the
Yeah, like
sculptures and the
it's
temples
historically
there.
significant.
So I've been there.
Yes, sir. It's historical, like
Yeah,
it has
it's a
historical
great.
significance. A lot of historical significance.
Yeah, true. I think Hampi, Belur, Halebed, all these are very famous sites across Karnataka in tourism for, especially for people who like
Yes, sir.
temples and architecture and all that. So, hailing
Yes,
from
sir.
there, Hassan district, great going. And of course, our own Jipmar, backyard of Tamil Nadu, and a really great place to do post graduation. And
Yes,
MS
sir.
there is a great thing. So, tell us a little about your journey. How, you'd have had hardly any time to sit down and prepare. So, how did you actually crack it? This is something that many will be waiting to hear.
Yeah.
You are like the bookcase in surgical oncology now.
Yeah.
One of the youngest to crack it.
Actually,
Grandmaster.
yes, sir. I joined MS almost like 3 years back from now, and of course, like when you join, you don't have any idea about the branch surgery itself. So the first 1 year is all about running around frantically and like getting to know stuff. But then, as you reach second year, you'll try to get hold of what actually going on in the department. For me, it's almost like by the mid second year, I was very sure that I wanted to pursue surgical oncology. I was basically interested in cancer from the beginning. Either it may be a neoplasia chapter in Robbins or so many other things, like whatever that was related to cancer. I was always curious about it and I was excited about it. And then I think by the end, almost like the mid second year, I decided that this is something like a purpose for me, and then I'm going to lead my rest of the life pursuing surgical oncology, sir.
That's great. I find a lot of people from Tamil Nadu, from Karnataka, from Andhra. These three people, postgraduate surgical postgraduates, have a big affinity for surgical oncology. Many people are interested in this, and again, the same thing goes for Tata and this one, Gujarat and Maharashtra. Again, you
Yes, sir.
find a lot of candidates. These are all, you can see some clumps and clusters of students who get in there. So, how did you actually prepare in this? You must have had a very short time in between, the exam
Uh,
and this one. So, what did you do?
yes, sir. Like for me, like as we all know that the residency is very hectic, especially in Jitmar, because we get to work a lot. We get to see a lot of cases. The exposure is very good, and also in terms of oncology, also like. Believe it or not, like 8 out of 10 cases that we see in Jitmar will be related to some one or the other forms of cancer. Mostly it's GI cancer, like that we are exposed to, and a lot of breast cancers. So we have a very good RCC department in Jitmar. So I think it's kind of serendipity for me to end up in one place where they had a lot of caseload related to oncology. Of course, it piqued my interest from the beginning, sir.
That's great. That's great. And now it's a $1 million question. Where would you be choosing? Will you be choosing Jipmer or will you be choosing AIMS, your alma
Uh,
mater, or is it going to be AIMS?
I think, yeah, like by the mid second year, I decided like I wanted surgical oncology, and I think 6 months I researched everything, and I rounded on AIIMS New Delhi, sir. It has been my
Oh,
dream college since the beginning. I think so. Like it's kind of surreal for me that hopefully I'm getting into like AIIMS New Delhi.
great, great, great. So, how did doc tutorials actually help you with your preparation? What did you use in the doc tutorial material? And, how did it help you in your preparation and getting the number one rank?
For me, like there are a lot of seniors who cracked INISS before itself. Sir. In Jipmer, we have a lineage of all those top rankers who got a good rank, and they always told that like they had prepared from doc tutorials. Sir. I think for me, from doc tutorials, I had given I had taken this grant test from doc tutorials. Sir. There are a lot of grant tests in doc tutorials which helped me a lot. So basically, in this surgical oncology, I remember there were like 2 to 3 questions which were directly out of grant test. For example, I would just like to recall that one of the questions, like they had asked about the regimen, the cross regimen, what is the radiation dose? So it's 41.4 gray. At that point of time, like for me, it was like a spinal level because I had solved that question already, so there was no confusion. And also, like there was one question, I think on achalasia cardia, sir. I still remember in one of the last GTs that Dr. Rielson has conducted, they had asked a similar question on achalasia cardia. So as I was preparing for oncology, of course, I had not gone through gastro things, and also, of course, I had not read about achalasia cardia. But I had got that question wrong in the last GT, so I reviewed that question briefly, not like completely into it, and I was able to get it right during the final exam, sir. So it's always about solving as many MCQs as possible and giving the grant test. I think I gave around 15 to 16 GTs, I guess, in last 1 month alone. Like every 2 days, I used to give GTs, and I used to review my answer, like correct questions and answers. And always my seniors told me that 65 right questions is like should be our target, because if you achieve that target, like it doesn't matter whether you do good in interview or not, because you will end up getting a good rank anyway. So that's it, sir. Like the grant test did wonders for me.
That's great. It's basically, going back to the basics, what we do for our NEET PG preparations. We go and read MCQs, and then we solve them and then go through the books and material. In the limited time that you had, you must have been preparing based on that. And I think the GTs that were conducted by Doc Tutorials had a big role to play. So anyway,
Uh,
congrats. It's a marvelous feeling, and we are happy to have you.
Thank you.
Your role is equally important. Like I tell all my students, it's the student who is doing it, it's the candidate who is doing it a lot, and we are just a little signpost or guidelines along the way, and we help you kind of like show the path basically, and then you know you walk the path. It's not us who are doing it. We are there
Uh,
hand holding you, guiding you, but it is you who is
mm,
walking the path.
no, sir. I would like to differ. There is a concept called Ubuntu in African.
Yeah.
In the Africa, like it's
Like the
called, it's
Lineage
all about
program,
we and
yeah.
it's not I. I think I would just credit my success to so many other people. Those are involved in my life, and it's not just me, sir. I think only like 5 to 10% is me. I guess it's just we. And I like to say.
So would you like to, thank the people who have been helpful to you in your journey now? This is the opportunity for you to do that.
Yes, sir. So mainly, I would like to thank my department, sir. That has been really wonderful, and I've been trained there. So the gratitude will always be there, sir. All my professors were really wonderful, and of course, my juniors in the department of surgery and seniors in the department of surgery, sir. Especially, I also would like to thank all those MBBS people out there who are in Jipmer. So they used to come for clinical cases and all. I used to take classes for them regarding breast cancer, right? Maybe mass per abdomen and all. They were so brilliant, and I think I learned a lot from them than me teaching them, sir. And last but not the least, of course, my family and friends. And I just want to thank one of my seniors, sir. Like, I think 1 year back, like in gastroenterology, a senior named Kavyashree, sir. Like she got rank 3, AML rank 3. She's in AIMS Delhi currently. Like she was the one who guided me throughout all my journey. She was my senior in MS also. Like she was the one who used to motivate me along, and she was the one who guided me. Sir. Like I would thank her, like especially for that.
That's great. That's great. Without our seniors, without our friends, we all take help from them in some way or the other. I still, credit my thing to joining a post graduation course at that point of time.
Sir.
During my internship, I joined one of these courses. The only thing was like one senior guided me and said, you take it up. Even though you have your internship, you'll be busy. Whenever you can, you go. That will help you, and that helped me get my MS immediately. So that those small things will make a lot of difference. And I think we are all indebted to a lot of people through our life, as you say,
Yes, sir.
the concept
Like,
of Ubuntu.
yeah,
That's
it's
very
we
true.
more than me.
Yeah, we who work together and we go. And so
Yes, sir.
wishing you all success, Nikhil. And we are happy to be associated with you in your success story and in your journey. And from doc tutorials, I think we can definitely tell you that this material will be available to you with the updates as well, through the
Yes, sir.
course, so that you can make use of it whenever you want to. And maybe you already started your teaching journey. Maybe we can look at integrating you into it if you have the time in the future as well.
Yeah,
So
thank you, sir.
congrats
Thank you so
once more,
much.
Nikhil, and enjoy your time. Take some time
Yeah,
off and have some time with your family and friends, and then you go and join the course. Welcome to surgical oncology as a young colleague. Soon we'll be seeing you go places. Congrats once more.
thank you so much, sir.
Thank you. Thank you.